22 performing test 43 doing an overneedle catheter and a cephalic vein of a dog. So I have all my supplies here. I have my clippers, I have chloride scrub, I have alcohol, I have my sterile gauze, I have 2 flushes, one to flush the catheter and one to flush it while it's in the vein. I have a catheter, an injection plug, I have vet wrap, and I also have tape to anchor the catheter in for his appropriate length. And then we're just going to go ahead and get started. We're going to go ahead and plug him in a restraining position. I'm just going to go ahead and clip up the hair. All the way around. Careful not to get him razor burn. Now that we have that, I'm just going to go ahead and open everything. Without contaminating it. Open my injection plug. That one seems like there it is. I'll grab another one. Open that. I'm going to go ahead and open my catheter and I'll flush this without taking it out of the case. Seems to be going pretty smoothly. Okay, now that we have everything open, I'm going to go ahead and take my first chloride scrub. I'm going to go ahead and scrub all the way around. And again with alcohol.
You said you saw tapes on that, right? Yes, absolutely.
And our final scrub.
And I did not put it in the computer, but I did just text Judy. Okay.
Now that is scrubbed, I'm just going to go ahead and kind of not take it out of the case, but just pop it open so I can easily grab it. I'm going to take my sterile gauze, take it from the corner, and wrap it on the distal part of his hair.
I think we tried to get it earlier.
And I'll grasp underneath it.
She said no, thank you.
I'm going to insert my needle, beveled up. Now that I have a flash of blood, I'm just going to go ahead and advance it off the stylet. And she's just going to hold right on the distal part just to keep the blood from flowing everywhere. Take my injection cap, place it on. And we have that. I'm just going to remove the gauze. Without kinking the catheter, I will go ahead and anchor my tape in. It's okay, buddy. Now that that's in, I'm just going to go ahead and make sure my cap is on completely. Take another piece of tape, anchor that in. Then I'll use my flush. I'm going to flush the catheter with heparinized saline, and I'm going to go ahead and do a whole 2 cc's. My name is Amber Griffey. I'm going to be performing task 23, the discussion part. So, listing some possible complications associated with IV catheters. Phlebitis is one, which includes redness, swelling, anything like that. You can accidentally blow the vein. You can introduce bacteria if you're not using your aseptic scrub correctly. The next one is, what should you check frequently with IV catheters? You should check you should be flushing with heparinized saline every 4 to 6 hours, but you should also check for any edema, redness, the heat, or anything like that. And then the next one, what precautions should you take to reduce the chance of an animal that could chew or pull out the catheter? You should double check the bandage, make sure that it's not wet, so that make sure that they're not licking at it, or if there's any bleeding around there that could cause it to be irritated. You should put a cone on them to keep them from getting to it. And then lastly, what is a proper dilution of heparin to sterile saline, which is 4 units per ml?